नमस्कार आपने समस्त को मुझे आपनकर एक्स्ट्रा लार्ज आरजे कोमल मणिपाल हॉस्पिटल भुवनेश्वर आपनको ପାଇଁ ନେଇ ଆସିଛନ୍ତି healing with Manipal। सो आज आम सहित अछंती डॉक्टर हर्ष मोहन पाठक सर जे होचंती डेंटल एंड मैक्सिलोफेशियल सर्जन। सर नमस्कार, वेलकम टू रेडियो चॉकलेट।
Namaste.
सर कैन यू प्लीज एक्सप्लेन अबाउट व्हाट इज मैक्सिलोफेशियल सर्जरी?
See, maxillofacial surgery is a specialized department which is done after the department of dentistry. After the students are doing after BDS, they do an MDS and pursue a 3 years degree course in maxillofacial surgery. Maxillofacial surgeons are trained to cater all the requirements which is above and into the oral cavities. That is the wisdom teeth problems. They tackle jaw bone fractures. They tackle small cyst tumors of the jaws. They also tackle rhinoplasties, cosmetic procedures. And more or less the most demanding subject is oral oncology and their reconstructions. So in total, maxillofacial department caters your need and they beautify your face above your neck.
Sir, if we want to know about the procedures that are done in maxillofacial surgery, can you please explain about that?
So the most common procedure done by the maxillofacial surgeon in a day-to-day practice is removal of impacted wisdom teeth. जेटा को लोक माने कहउछंती ज्ञानदांतटा. Wisdom teeth, basically it comes around 18 to 25 years of age, and most commonly in nowadays situation it is impacted. That means it is not coming in the straight angle. So because of size of the jaws are less, so the wisdom teeth does not have good place to erupt. So the maxillofacial surgeons, what they will do, they will just open it and remove it. So your problem is solved. Another frequent procedures are treatment of accidental jaw fractures. That it takes about the fractures of jaws, mandible, maxilla, nose, orbit, ear, the cheekbones. So these are the second most practice. The third most practice and the more important practice is oral oncology. जो माने लोको tobacco खाउछंती, जो माने लोको पाटी रे घा अच्छी, red and white lesions अच्छी, पाटी टा पोड़ू छी, burning mouth sensations अच्छी, से पाई भी maxillofacial surgeon their services render करूछंती.
सर बहुत टाइम में फ्रैक्चर हो जाता है एक्सीडेंट के वजह से, पीपल फेशियल डिफेक्ट्स आ जाते हैं. सो हाउ इट कैन बी डन बाय अ मैक्सिलोफेशियल सर्जन? फेशियल जो भी फ्रैक्चर होता है, हाउ इट कैन बी डन?
See, once we receive the patient in our hospital through our emergency ward, first we tackle can clear the airway, because if the lower jaw is fractured, the patient is not able to breathe well. There is all blood clots inside the oral cavity which can affect the airway. So what we do is we reduce the fractures. What the reduction of fracture is, the bones which are fractured, they are again aligned. So my patient should be able to eat well. He should be able to have a good cosmetic facial height. Facial deformities should not be there. There should be no soft tissue defect. There should be no future pain regarding that area where the bone has been fractured. So this is very critical zone actually. Initially older days this speciality was not much. So patient would be like paralyzed for his whole life. They will not be able to eat well. माने खाइबा टाइम रे chewing properly होबो नहीं. Say facially nose टा बांका थिबो. So all these procedures are done by a maxillofacial surgeon, and the specialized treatments are all available.
Sir, जने मैक्सिलोफेशियल सर्जन कर भूमिका कौन रहिची ओरल ऑन्कोलॉजी रे?
See, this is the most upcoming stream in maxillofacial surgery. Oral oncology basically पाटी रे घा रहिबो जोटा की heal होबो नहीं. और biopsy proven oral oncology means squamous cell carcinomas अच्छी, सार्कोमास अच्छी, जो जगह रे रिसेक्शन दरकार, से लोअर जॉ रे अफेक्टेड अच्छी, अपर जॉ रे अफेक्टेड अच्छी. तो यही जो प्रोसीजर अच्छी ना, एटारे मैक्सिलोफेशियल रे रोल कौन कौन रहिबो, से रिहैबिलिटेट करि पारिबे. से ओरल ऑन्कोलॉजी जो घाटा अच्छी, से घाटा को प्रॉपरली রিমুভ করিকে সে নেক ডিসেকশন করিকে যে জায়গায় এই ক্যান্সারটা যাই পারে সেটাকে নেক ডিসেকশন করিকে এটাকে ভালোরে রিকনস্ট্রক্ট করি পারিবে না এটারে মেজর রোল কন হব ম্যাক্সিলোফেশিয়াল সার্জনরে এটাকে রিকনস্ট্রাকশন বিকজ দে আর হ্যাভিং দ্য নলেজ অ্যাবাউট the occlusion, the dental part, the tongue part, the post rehabilitation, that is after surgery, after radiation, how the patient will eat, how they will again go and socialize in the society. They will not have much of social defect. Cosmetic appearance in oral oncology is of the major role. So that is the main role of maxillofacial surgeon.
Sir, basically I just have a simple question. How come we can know ki we are having a cancer, something is happening over our jaws or something infection is over there? How can we know about that and detect that?
See, it is like any unhealed ulcer which will go for more than 3 weeks should be tested. This is number 1. Number 2, if you are having a white patch, having a tobacco history, having a sharp teeth, having continuous habit of chain smoking, something which is not advised and which is already with a nicotine power. So our oral cavity will have an insult. The oral skin will be red, it will be white, there will be burning sensation, there will be bleeding, there will be unhealing sockets after extractions. So these are little signs of oral cancer.
Sir, एक maxillofacial surgeon का क्या role रहता है when it comes to dental implants?
See, dental implants are the procedures where we replace a teeth. भावन्तु गोटे जगह दांत नाही लोअर जॉ या और अपर जॉ से जगह सर्जरी है कि गोटे स्क्रू दैट इज टाइटेनियम स्क्रू टा प्लेस होए दैट इज अ डेंटल इम्प्लांट. नाउ वंस दिस सर्जरी पार्ट इज द बेस्ट पार्ट to be done by a maxillofacial surgeon. What he can do is he can preserve the nerves, the sinuses, the nasal floor. He can place the implants in such an angulation where the implants will be stable. The longevity of implants will be the highest. And maxillofacial surgeons and prosthodontists, they are the team for a dental implant procedures.
What will be your piece of advice for people for a healthy oral health?
My piece of advice will be brush twice and rinse twice and eat less amount of sugars after 7 p.m. in the night.
Thank you so much, sir, for your time. So, ବର୍ତ୍ତମାନ ସମୟ ସଦରେ ଆମକୁ ଯିବାକୁ ପଡ଼ିବ ଶୁଣୁଥାନ୍ତୁ ରେଡ଼ିଓ ଚକୋଲେଟ୍ରେ ମିଠା ଗୀତ ଫିଲ୍ କରୁଥାନ୍ତୁ ଧୁମ୍ ମିଠା.